when we think about sort of healthcare systems and what it's done to Black people in general, unfortunately, there's just been reluctance to speak to our doctors because they don't believe us. They dismiss our symptoms. They think we have this high tolerance for pain.
Tonight, we're going to be talking about a very important topic, which is postpartum depression, the mental health challenges of moms after childbirth. So all of you new moms, future moms, expecting moms, this is for you. I just want you to know that you are not alone. There is a way to be proactive, and we just want to bring more awareness about postpartum depression. I suffered from postpartum depression in 2018. And I feel like doctors, they prepare us as moms to have healthy babies, to be healthy with what we put in our bodies, but we don't receive enough awareness about the mental health challenges that we experience from those hormones or from the pressures of being a new mom. So I'm so excited that we have a special guest on tonight that's going to help us to shed more light and raise more awareness about these mental challenges that we have. And so I'm going to go ahead and let you introduce yourself and then start with the discussion.
All right, let's do it. Hi, everyone. Good evening. My name is Aneem Awe. I'm a licensed clinical social worker. I'm also a clinical health educator and a wellness consultant. And part of the reason why I'm here tonight is to talk about postpartum depression. I've spent a number of years working around postpartum depression. Also wrote my dissertation around postpartum depression. And what we find often that happens is that Black women will suffer at a greater proportion, but also won't be able to get the support that they need, unfortunately. And what happens, and what we saw with the numbers, particularly in Massachusetts, because I am from Boston, and so where I did my dissertation and where I did my research work was in Boston. What we did when we looked at the sample size is that affluent women with education, all those women were more likely to get screened and get the support and resources that they needed, as opposed to Black women, unfortunately. And so we naturally, the question was, why aren't Black people being screened? Black women, rather, why aren't they being screened? Why aren't they getting the support they need? Why aren't they getting the resources? And oftentimes, when we think about sort of healthcare systems and what it's done to Black people in general, unfortunately, there's just been reluctance to speak to our doctors because they don't believe us. They dismiss our symptoms. They think we have this high tolerance for pain, allegedly, is what some of folks have said, unfortunately. And so that impacts how we show up in healthcare systems. So unfortunately, we're less likely to sort of ask for help or get the support that we need because we feel like we're going to be stigmatized, or we're going to be judged, or we're not going to be listened to, or we're going to be dismissed. And unfortunately, a lot of that plays into how bad or the severity of postpartum depression, or the experience, rather, of postpartum depression with a lot of Black women.
Yes, I 100% agree. It's so needed in our communities, our culture, that therapy and that awareness of, knowing the signs of mental health challenges. And you mentioned something about stigma. So there is a stigma in our culture as Black women that we're supposed to be superwoman and always project strength. What are your thoughts on that and how that negatively affects our mental health?
Yeah, that's a good question. I think we have developed this psyche around being a super strong woman because it's come out of a necessity, unfortunately, given the circumstances that we face day to day as being Black women. But while that may be the case, I do think it's actually more harmful than good. It's a defense mechanism. It's something that we've learned to put up our guards up because the world doesn't treat us good, and that's just how we learn to navigate. And I get that part. But while it is that defense mechanism, it actually, for me personally, I believe it does more harm than good. That having to sort of walk around life and navigate life in that manner, at the very least, it doesn't allow us to experience true joy. It doesn't actually allow us to be present, in this life. And so unfortunately, walking with that guard and that shield, it impacts us in some ways that we may not even understand. So while it serves its purpose, and that's what defense mechanisms are, they help us sort of navigate life because of traumas in the past, because of issues that we had, and it serves there to protect us. But also the opposite of that is just like living in sort of this reality where we always have to be guarded, or that fight or flight sense is always up, and what that does over time is literally tear down the body. So when you think about the connection between mental health and physical health, when we're always in this state of fight or flight mode, we're constantly fighting, like over time that breaks down the body. That's releasing that cortisol hormone in our body, which literally, it was, when we think about sort of back in the day, like dinosaur times and things like that, that was a response to help alert our body that danger was around. So when we're constantly in that danger mode, our body's releasing that cortisol hormone, and it literally is weakening our immune system. It's impacting our health. And so you literally see how that interrelates with one another. And also when you think about the health outcomes with Black women have the worst health outcomes. It's no wonder when we sort of have to, when you think about those sort of three levels where you're constantly having to be guarded, you're walking in this fight or flight mode, and then it literally impacts one another. It's like one thing triggers the next.
Yes, yes. And I'm glad that you mentioned that it affects not only your mental but your physical. It breaks down your your health in your physical body.
Yeah.
And so my question is, in mental health terms,
Mm-hmm.
how would you define what postpartum depression is?
Yeah, so I think postpartum. So I'll take it even a step further. So often, what happens when you have a baby is that you'll experience this sort of postpartum baby blues, and the difference ultimately between baby blues and a full-blown postpartum depression is really the length of symptoms, and the time frame of the symptoms and the intensity. So baby blues, we're going to see that lasting for anywhere from a week to two. So that's sort of a normal experience. Again, your body sort of and your hormones are restabilizing. You're adjusting to this new life. You're adjusting to the sleeping patterns. That is a normal response. However, when you go ahead and then things continue or persist, right? There's been some unaddressed stress. You have no help. You're living in an environment that's conducive to stress. So you're not getting any sleep. You're awake. Now you're suffering from insomnia. Your anxiety is so bad. You lack your appetite at this point. That's when it's like postpartum depression. And why it matters is, not only is it impacting you as an individual, again, we talked about that connection between mental health and physical health, but also the long-term effects is that when you don't get help, it impacts the relationship between mom and baby, which can have negative impacts later on.
Yes, yes. I agree. I know when I went through postpartum depression, I had a hard time with her latching on, so it does affect that bonding time.
Yeah.
Because you're trying to adjust, like you said, to a new life of having a baby, but you're also trying to still find yourself, rediscover yourself within that process.
Yeah.
It can be very challenging.
Absolutely.
So I would say I think that people don't realize the severity of what postpartum depression is, especially in our culture,
Mm-hmm.
and the effects that it has on our mental health with being new moms.
Yeah.
Even with my doctor, it was very severe, where she was like, hey, we have to get your husband in here now so we can sit down with him and really explain to him the effects of mental health, that how it's affecting your mental health. And an alternative was for me to be medicated, and I didn't want to be medicated, so I did other ways of therapy to kind of get through that phase.
Yeah.
So what I would say is, to me, I was blessed to, of course, have my husband to support me.
Mm-hmm.
Even if it is someone who doesn't have a supportive spouse or doesn't have a spouse at all.
Yeah.
Would you recommend that when they attend therapy, that maybe bring the spouse or a support system to the first session? Or is there a way that a new mom can explain to a spouse or a spouse or a family member what they're going through as far as postpartum depression? Is there a way to kind of break it down to them where they understand it and can be a little more supportive?
Yeah, you mentioned a good point, that support system. Support system is incredibly important for new moms, moms expecting again, whatever the situation where you're, wherever you lie. That support is so monumental and one of the biggest risk factors or social determinants that will determine whether a person may experience postpartum depression or not. So support is really big. In terms of having the conversation, it depends who your provider is. So I'm not sure if you guys are familiar with Our Culture Care, but if you're not, they're an amazing new sort of OBGYN practice that's online, and they provide a holistic care. So that means they provide lactation support, mental health support, and you get the doctor, you get a whole package all in one. And really what that does, you know, someone in the comments mentioned perinatal depression, so having depression during the pregnancy, and that can happen for a number of reasons. So making sure that you get all areas of that addressed. And part of, you know, meeting with the therapist during perinatal support is, you know, maybe that is having the conversation with your husband or your partner, whoever it is, and explaining to them what, you know, what postpartum depression is. It doesn't necessarily mean you're going to have it, but here are the signs, here's what to look out for. And some of those signs could be mood swings, right? You know, he may be getting irritated with you, or she, whatever your preference is. You know, how do I mitigate that? How do I support that person? And making sure that you guys can have that conversation and clear up any or dispel any sort of concerns that may come up. I can't undermine the importance of a social support network. Now, whether you're with your, you know, the child of your father or whatever the situation is, having support, whether it's your family members, you know, is there a way that you guys can trade off? Can I sleep for a little bit while the baby sleeps? Can you take the baby? Can I go for a walk? Like making sure that you have a plan with these close people, because that is really going to be the difference in how you experience your postpartum depression and how you overcome it as well. Because the other side of that as well is that unaddressed postpartum depression then turns to a full-blown major depressive disorder, right? Or, you know, and that's something that people struggle with for ongoing years and years and years until it's fully addressed.
Yes, yes. I 100% agree, especially being that I went through it, because it lasts for like almost 2 years. And my husband was like, is it almost over now? And I'm like, I don't know, you know, like this is all new for me.
Mm-hmm. I'm glad you talked about medication too, because it's definitely a route that you can take. It's not the only route, and you know, some people are going to be more open to it and some people are not, and that's totally fine wherever you land on it. It's not the end all be all, but medication is only as effective with talk therapy, right? Medication will never take all the edge away in terms of mental health. I can't speak for like medical issues, but in terms of mental health, medication is most effective when you couple it with talk therapy. So with medication alone, while we may think it could help take off the edge, it will take off some of the edge, but it won't clear up a lot of what is going on, unfortunately. So it's best to couple that medication piece with talk therapy. That's how you get more bang for your buck, so to speak.
And I'm glad that you mentioned that, because that is another stigma in our culture. Like you said, when we go to certain doctors, you know, we're offered, you know, we're offered medication, and there are alternatives and different types of therapy that we can do, because we want life-changing results. We don't want to be in a place where we always have to be medicated.
Right.
You know, we can't be completely who, you know, the best version of ourselves that we can be. So I'm glad that you mentioned that. I'm glad that you also mentioned Our Culture Care, and they, you know, that resource, because I don't think a lot of us know about the resources that are available out there. So that was going to be my next question, which I know other people may have this question as well. Is there affordable mental health care? And are there other resources available, and how do we kind of get to those resources to seek further therapy, and even, like you said, to be proactive and get those full screenings as African American women, so that we can be a little more prepared and know the signs of postpartum depression?
Yeah, that's a good question. So, unfortunately, mental health care system is totally broken in this country. So, here are my tips. My first tip is I put Our Culture Care in the chat. So, if anybody's interested, check them out. So, 100% Black owned. So, if not that, you're going to your regular OBGYN or your midwife. What you want to ask them is that, hey, I think I need a PHQ-9 screening. And what a PHQ-9 is, a patient health questionnaire assessment. So this is a basic assessment that all healthcare providers can do, whether you're mental health, medical, whatever your line of duty is. And so what it does is assess for a basic level of depression to some extent. So based on the score range that you score in, so if you're like a 17 or over, that's an indication to me or the medical professional that there may be some issues going on here. I need to make an appropriate referral. So unfortunately, we have to come in ready and prepared to educate our providers sometimes. And so asking that patient healthcare questionnaire, or PHQ-9 for short. The other thing is, depending on where you are, like, I did a lot of work in California, in the Bay Area, Alameda County specifically, and Contra Costa County. So a lot of them had perinatal services embedded into their Medicaid services. So a lot of those women who were receiving Medicaid were already having to meet with therapists, or they call this perinatal behavioral health specialists, because it was embedded into the program. So that's a beauty. That's because it's already built in. Unfortunately, I think it's advocacy on our part. And being able to throw these sort of terms out and demand that our healthcare providers screen us for these type of things. And if you are having concerns, don't be afraid or don't hesitate to have that conversation with your provider. Or if you already have an insurance plan, you're concerned and you're worried about sort of your mental health and your pregnancy, you can contact your insurance directly and contact the behavioral health unit and ask for referrals for therapists that are in your area that are accepting clients right now. And that's one way to sort of mitigate the insurance barriers, because you're getting it from the insurance mouth themselves. Like, these are providers, we're going to cover these, they're in network. You don't have to worry about the cost factor. The legwork then comes in kind of contacting people and voicemails, and unfortunately that piece around that. But I would say advocacy, asking for it, and not being afraid to have those conversations with your doctors. And if you don't feel comfortable with the doctor or the provider that you're seeing, you have every right to switch to the next one. Just like I encourage people to switch their therapist, if that's not a good fit, you can switch your provider as well. You want to make sure during these critical times that you're working with somebody that's listening to you, that you're respected, your voice is being heard, you're being validated, and your concerns are not dismissed. So you want to make sure you have a comfortable relationship with your healthcare provider as well. So definitely check out Our Culture Care if you can. They provide services all over the country. It's all telehealth based, but they do provide a holistic approach that I think is really important, especially for Black women who often get undermined and dismissed in the healthcare system. And so I really, really think it's a really great program. If you have the chance, you can purchase some of their bundles. I know they're giving away some bundles for free, depending on a woman's income situation. So that was a lot, but definitely, don't be afraid to ask for these type of things. And somebody mentioned PMADs. What is the best thing to do if you can't talk to your family? If you can't talk to your family, whether it's support system, support system is so important when you're pregnant and when you're going through that, or after having the baby. A support system, whether that's friends, coworkers, however you define support system. It doesn't necessarily have to be our families, right? Because unfortunately, some people are in families where they can't turn to them for anything, and they find themselves closer to friends more than their blood relatives. So however you define support system, please make that plan for yourselves. What's that going to look like? There was an article about single mothers moving in together and creating their own communities. That's powerful. That community, it takes a village mentality. That's what they're building there, because there's an importance there. Our ancestors did that because there was value and there's importance in that village approach rather than the individual approach.
Yes, and I'm glad that you mentioned that. That really helped me a lot too. I had two friends. We were all pregnant at the same time. Wow. And we didn't know anything about postpartum depression or prenatal depression, but all of us were experiencing that. And we just came together and we held each other accountable, and we checked on each other, and we supported each other throughout the entire process up until the time now where our kids are like 3 years old. And I'm glad you mentioned the assessment.
Yeah.
Definitely ask for that assessment, because that assessment really helped me when I went to my healthcare provider. I was so blessed to have a African American healthcare provider, and she immediately knew what the signs were. And every time I came in for my checkup, she would give me that assessment to see where I was. And it really helped me to know the signs, because I didn't know what I was experiencing. I was just depressed a lot and crying a lot. And she really helped me with that. And her bringing my husband in to understand what I was going through, and him being a little more supportive about it, it really helped me. So I'm to mention that as well, because it's very, very important. And unfortunately, in some cases, we do have to ask for it. It's not something that's proactively offered to us in our.
We're working on it, like on my end, right? But it, unfortunately, having so coming in to your appointments and having some basic understanding, knowing what you need, or able to put the words on what you need and what you're feeling, is going to be really important in terms of self-advocacy. But folks are working, and that's part of, like, folks that have been in the field like me, been in there a long time, that we're advocating to make sure that this is a standardized process. But unfortunately, until we get there, that it's important to have conversations like this, so that people can walk away from this and saying, oh, when I go to my next OBGYN visit, I'm going to ask for XYZ, and, not be, you're right. You have a right to care. You're paying for that care at the very least. If you want to look at that, you're a consumer. So you want to make sure that you're getting what you're paying for, if we can be really frank. And the other thing I wanted to bring up is, we're talking about postpartum depression, but the other piece is also postpartum psychosis. And essentially that's experienced psychosis, delusions, paranoid delusion, things like that, following the pregnancy. And that's also something that can happen as a result of postpartum, or unaddressed postpartum depression is the psychosis piece. And so again, we have these conversations so that, one, we can normalize, and two, we can recognize when we do begin to sort of see these signs, and when it's time for me to get that support that I need, or that help that I need, and where I can turn to.
Right. Absolutely. Yes. And I love that. Because what you just mentioned, I didn't know anything about that, just postpartum depression and baby blues.
Yeah.
And it led me to want to become an advocate and actually start a program with my nonprofit to help new and expecting moms, to kind of like educate them on the mental health challenges, like you said.
Amazing.
So everyone may not experience it, but so that we can be prepared and have those resources there available, because we don't have a lot of them right now.
Absolutely.
So what would be your, what would be some like closing remarks, or like final encouraging words for any moms that are expecting, new or future moms that are tuned in, that may be battling postpartum depression right now, or now that we've brought awareness to it, that may be having a little bit of anxiety about it, like, oh wow, I hope I don't go through that. You have any encouragement?
I want to normalize and say that what your experience is, first off, it's normal. I don't like to use the word normal, but it's okay. Over 70% of women are going to experience this phenomenon, if I will say, and that it's more important to get help earlier, sooner rather than later. And whether you have the support system in place necessarily or not, please, contact your primary care provider. That's a good way, a good entryway, especially with the insurances, depending on what plan you have, to get any sort of supports and services. They can send a referral to anybody. So that's a good way to get the start. And that, most importantly, just normalizing this, and that this is an experience that a lot of women have, and it's okay. But most importantly, it's okay. It's important to get help sooner rather than later.
Yes. And I love what Khadijah in the healing space said in the comments. She said it's not okay to be okay, and that's pretty much like what you're saying. It's
right.
No, we just want you to know you're not alone. Like, there are so many moms that have gone through postpartum depression.
Right.
We don't want you to, because that's another stigma in our community, that we have to suffer these conditions in silence because we're embarrassed, or we feel like we're the only ones, but we're not.
Yeah, and that shame keeps us in silence. That shame prevents us from getting the help that we need. That shame makes us feel like we're the only ones. And so if we can dispel that shame and normalize this experience for women, like having this conversation right now on live, that we can hope that more people will say, hey, or see themselves in what we're talking about and be okay with getting help. So whether that's tapping into me, tapping into you, or tapping into our culture care, whatever the resource is, your primary care physician, whomever it is, making sure that you get the support that you need when you need it. And again, just remembering this is a normal experience. This happens. This happens to a lot of women. 70% we're talking.
Mm-hmm.
The most important thing is getting help and getting the support that you need, whether it's through your own village or perhaps there's some cultural views you have around it and there's some cultural pieces that you can work through it. Whatever it is that your healing avenue looks like, tap into those resources or tap into that network and make sure that you're not doing it alone.
Yes, yes. Thank you so much
You're
for
welcome.
today. And just as you can see, as we all can see, this is a long journey ahead for
Yeah.
our culture, and just bring more awareness to prenatal, like you said, and postpartum depression. So any moms out there, that are just now being aware of this, or you want to do more, feel free to start a support group or
Yeah.
see how you can become an advocate to get involved. I'm going to also drop in the comments when I post this to my IGTV. I'm going to post your information for
Okay.
any moms, new expectant, future moms, or anyone who just wants to take a step further and seek therapy, because you are a licensed medical health provider and clinical
Yep.
health provider.
Yep.
And you do provide telehealth, which
Yep.
really great. Especially it helped a lot of people throughout the pandemic.
Definitely.
Option, because we can't always get out and get to our therapist or get to our doctor. So that's something
Exactly.
amazing that has been created. And I
Exactly.
want to thank everyone who joined today. Share this video with someone that you think may need it. Share,
Yes.
period. You never know who's suffering in silence and who
Yep.
just needs that extra encouragement to seek therapy or to seek some type of support.